Okay. Members of the public wishing to participate in the meeting must use their full name for Zoom access. If full names are not used, people will not be allowed to participate in the discussion. The town reserves the right to remove any member of the public from the meeting who does not use their full name or acts inappropriately. And I'm just going to confirm members. As a preliminary matter, this is Atlin Sweeney, the chair. Permit me to confirm that all members and persons anticipated on the meeting agenda are present and can hear me. Sorry, I have a leftover cough. And a pop-up. As a members, I will call your name. Please respond in the affirmative. Veronica.
Here.
Suzanne.
Here.
Tara.
Here.
Jennifer.
Here.
Staff, when I call your name, please respond in the affirmative. Jericho.
Here.
And we are missing Anne. Good afternoon. This open meeting of the CHS is being conducted remotely pursuant. Actually, I have a recording I can read for this. Am I right?
Yes, you are good to go on that.
Yes, I am going to do that. Bear with me. I'm not in my home spot, so I'm a little slower.
On July 16th, 2022, Governor Baker signed into law an act relative to extending certain state of emergency accommodations, which among other things extends the expiration of the provisions pertaining to the open meeting law to March 31st, 2023. Specifically, this extension allows public bodies to continue holding meetings remotely without a quorum of the public body physically present at the meeting location, and to provide adequate alternative access to remote meetings. That does not make any new changes to open meeting law other than extending the expiration of the temporary provisions regarding remote meetings.
All supporting materials that have been provided members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I, the chair, note otherwise. We are now turning to the first item on the agenda. Before I do so, permit me to cover some of the ground rules for effective and clear conduct for our business and to ensure accurate meeting minutes. I, the chair, will introduce each speaker on the agenda. After they conclude their remarks, the chair will go down the line of members, inviting each by name to provide any comments, questions, or motions. Please hold until your name is called. Further, please remember to mute your phone or your computer when you are not speaking. Please remember to speak clearly in a way that helps generate accurate minutes. For any response, please wait until the chair yields the floor to you and state your name before speaking. If members wish to engage in a conversation with another member, please do so through the chair, taking care to identify yourself. After members have spoken, the chair will afford public comment to those members. I don't think we have any public on, do we? Okay. Finally, each vote taken in this meeting will be conducted by roll call, a roll call vote. Excuse me. So we will start with we've done established quorum. We will start with the revision of media reporting project. And Jericho, do you want to talk about this a little bit?
Yeah, absolutely. So the media reporting project was what the shorthand for the court report discussion that we had going for a little while. We had some difficulty getting responses from other people, but the one person who has been extremely quick to volunteer their time and perspective has been Jason Graziadei at the Current. So I spoke with Veronica and Athelin, was that last week?
Mhm.
Last week in order to discuss how we could handle a change to that. And we thought probably the best way to get started on this is to just invite Jason. He had another person he wanted to bring back and just have him share his perspective and any history about this. I believe he was involved in a couple of different attempts to alter how that's done on the island. And then see if the resulting media coverage of that discussion prompts a little bit more response from other stakeholders. So I think that was sort of a general go forward from that. It would probably be ideal to schedule that if either for February to start the discussion or March, because I think time commitments on Jason's part are going to increase as we get closer to summer. But other than that, we thought it'd be a good idea to run it by you guys and see how you wanted to work with it.
Any thoughts about that? Tara?
Just a thought and a question. I think it's great to at least get started, to have that conversation. That's important. But wanting to understand, have you gotten any feedback as to sort of lack of response or understanding of why there has not been response from others?
I
We
haven't
have
gotten
Has it
not.
just been okay? You just haven't gotten
Radio
anything.
silence.
Okay. All right.
I think that most likely what's going to happen is there needs to be additional attention on this to get someone who doesn't have a stake or a strong belief on this particular point. So I think one of the things that Council on Human Services can do in these sorts of situations is we're newsworthy. Our meetings are news. And so if we have a discussion, that becomes news, and that can then be used to discuss and get more responses, more interest.
Any other thoughts? Suzanne?
I have a question. When did this item of court reporting in the news first come to your attention, and who brought it up?
It was me, and it was probably a year ago.
Okay.
Yeah, I believe it was January of 2022
Mhm.
or thereabouts. It was immediately after, I think we had just done the Parenting Through COVID webinar, and we had been doing a bunch of work around support for quarantine and isolation, and then people quarantining or isolating due to COVID infected status. And then it's been kind of slowly brewing since that meeting. Yeah.
Was there some issue in the reporting in the news or something that made this come about?
Not particularly.
No,
It was, you mean, why would I have brought it to the
Yeah, I'm just
CHS?
curious.
There was a long time that I worked in the health and human service field. Well, I still am, but through more community-based work.
Mhm.
And a lot of times when people would come in and they had been in the paper, they would come in with a lot of shame around having been in the paper. And
Mhm.
we were talking about just having a discussion about this. Has it been looked at lately? Could it be a little bit different? Maybe they don't have to post names prior to at least going through the court system. So just really trying to look at, is there a way to reduce shame? Is this how we need to continue to do it? There have been a lot of changes over the years as well, going from print media to now online media. So a lot more people are seeing it. So just it felt like it deserved some time from us.
That makes sense. And I'm just curious, wouldn't it be that like police reports and stuff would be a precursor to things showing up in the courts? And would some of the people already be named by the police reports?
I think I think we talked about that a little bit. Like police reports are always accessible to the community. If somebody goes to look it up, it's accessible information. The question was, does it need to be printed in the papers and online? But yes, it is there first. And I feel like we had a discussion about, was that partly law for them to make?
We did, yeah.
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 Veronica, did you have a thought
And
about that?
we talked the difference about being convicted through a court process and being arrested. There's two different things. And once the name is out there under an arrest, that it's published online and in the paper, it doesn't sometimes matter that it was a mistake or whatever. The name is still there, and the shame and the effect on not only the person, but the family, et cetera, et cetera. So that's a little bit more of the background of where it came from.
Thank you. I just wanted to know.
Right. Jennifer?
I just add that in addition to the shame, this can have real economic consequences for people, right? That yes, there's the public embarrassment, but if I have been accused of something, my employer may find out, I may not get a job, I could lose my job. Like there's just all sorts of implications. My kids could be thought of differently at school. Like there's just long reaching consequences. And I'm not advocating one way or another, but I think there's a ripple effect here.
I think that's a very good point to be made.
I
Thank
know
you.
this is a tangent, comment, but I read something in the last day about the temperance movement on Nantucket. And, it wasn't necessarily because of people shouldn't be drinking, but it had more to do with domestic abuse. And it was a way of curbing potentially domestic abuse by eliminating alcohol from the scene. So it's a little bit tangent to what we're discussing, but it certainly all wraps together one way or another. So it's been going on for many, 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 many years, obviously. So,
Thank you, Veronica. I see you, Jericho.
Oh, no worries.
You have a hand
I
up.
just wanted to add that there is some historical context to this locally. There have been 2 or 3 different attempts to adjust how this is published. And those were in the very early internet days. I believe there was one around the 2000s, right as I was leaving for college. And then I believe Jason Graziadei himself was involved with another attempt to at least address or discuss how the court report is reported. A couple of things that have changed since those 2 previous attempts is that the much wider adoption of the internet means that instead of having to go to the library to find a back issue of the Enquirer Mirror on microfiche and then looking through to see who's in it, you can now just Google search. So these things are much more permanent now. I think that's something that could be discussed when we do have Jason on.
Great. Thank you. Any comments about feeling okay having Jason on and just getting this conversation started? If you can just do a thumbs up if you're okay with it. Okay, great.
Let the record show that was a unanimous assent to that.
Great. Wonderful. So I think we can wrap that up and say we can move forward with that, Jericho.
Gotcha. Moving on.
Okay. Moving on to director's update.
So that is from me, where I tell you what's going on with the town on my end, and you guys got to ask me any burning questions you have about the fascinating world of municipal governance. So to start, I'll do out of habit, COVID and respiratory disease. We have 2 more sets of tests than we did, wastewater tests, and we have a very, very sharp decline in the concentrations. Most likely, there was a bunch of transient people visiting over the holidays, and those are probably those represent a fair amount of that spike. It's following very closely to last year's cycle and patterns. I can't do an apples to apples comparison because of a change in methodology in terms of calculating the concentration, but Most likely we have already hit our regional peak. The next week and a half are going to be a slow decline in all of the respiratory illnesses going, and then we'll have a spike following the February vacation. Historically, that has been the largest spike every year. So as bad as it was a week or two ago, it'll be that bad again, or probably worse. And unfortunately, it looks like there is yet another variant that has come out. This last spike was probably partially what is charmingly called the Kraken variant, which I believe is an XBB sublineage that is very genetically distinct from earlier versions of Omicron. So even if you have gotten COVID in the last 3 months, there's a non-zero chance that you can be reinfected with this new variant. I can't remember exactly what the sub number is. It's like XBB1, and then there's a bunch more numbers and letters. But it's part of a new sort of like Omicron was a branching variant from the earlier variants from wild type and Delta. This is like looks to be potentially another subtype emerging and outcompeting earlier ones. And then just in general, what's the word I'm looking for here? Flu and RSV are also pretty common, but it looks to be about 3 to 1 flu to COVID. So significantly more COVID even than significantly more flu than even COVID. Other than that, steady state on that front. I'm also working quite hard on the Nantucket Behavioral Health Initiative, which is a island-wide collaborative and collective effort to cover gaps that we were discovered in the last couple of years through a survey of the behavioral health system on the island. It's actually being extremely fruitful. We just started a data collection program for all of the behavioral health resources on the island in the interest of getting a new resource Bible together and re-updating our online resources for residents. There's also some really interesting process mapping and some other kind of like more abstracted view of how we handle referrals on island and sort of mapping out the way that the behavioral health system, a person will travel through it, ideally so that we can A, check out gaps, and B, improve how people connect to the various resources available to them. After that, we just wrapped up the first year of the rural health initiative, and a lot of initiatives these days. That was a state grant that gave us money to do startups, to do startup programs with very, very lovely loose reporting. We can basically use it for a variety of different purposes. And the state has been like, do you want to use it for what? Sure. Every single time we've done that. So we got a youth yoga program up off the ground with that money. We secured staffing for a senior swim. We're assisting our house in getting a commercial kitchen put in there so that they can expand their food security efforts. What else did we do? Oh, a memory cafe at Sherburne Commons. And what else did we do? Childbirthing class for the Visiting Nurses Alliance, and then a couple of other ones that are not finalized yet, so I don't want to share them, but awesome grant. And if anyone knows a nonprofit that's looking for a $5,000 to $10,000 grant to start up a new program, feel free to email me. We've got another year's tranche showing up at the end of this month.
Good.
Now is the time for the questions and the answers. Tara, please go ahead. Sorry, I don't mean to talk over you there, Athlon. I know it's supposed to go through chair.
Yeah. Couple questions. What's the total amount of the health initiative grant from the state?
The state grant was part of the ARPA block grants. So and then was divvied up by the Office of Rural Health at state DPH. It is a 3-year grant with $70,000 the first year and then $80,000 the 2 subsequent years. We get the money on a yearly allotment. Anything that we don't spend out of that year comes out. Anything we don't spend that calendar year comes out of the next calendar year's allotment. So we only got informed of this grant in October. And it's so loose that it was difficult to get people to reply to it because they're like, you're just giving us money for anything. And
Yeah.
it took about a month for people to believe, yes, that is in fact the case.
Is-
Okay.
Yep,
Sorry.
go ahead,
Is
Veronica.
it on a calendar year or that you were just informed in October? So if you've got 70,000.
We had to do 70K by we had to get it off of the state's books into our books and then out of our books by the end of this month. And it is a calendar year. I think that I don't know why they chose calendar year, but it is
Okay.
a calendar year recurring.
And you've got 70K being distributed at this point?
Yes, we did just get about 70K out the door. That was 70 for the first year and then 80 for the
each.
next two. And I believe that is that money is committed. It is already like, it can't go anywhere else. So we have it. It was part of, like, I guess when the states were being allocated, or when they were allocating their ARPA money from the first full year of Biden's term, or Biden's term, they managed to slice a multi-million-dollar chunk of the ARPA money off to distribute everywhere, specifically as part of a rural vaccine initiative, to drive up vaccine rates in rural areas where access was less. And then they specifically added a chunk of that budget to us, to Nantucket specifically, because we were getting left out a lot of the rural stuff.
But it's hugely flexible.
Immensely flexible. If it like we've gotten behavioral health programs, we've gotten some technology programs, we've gotten equipment, we've gotten supplies, we've gotten nursing
Wow.
personnel time.
And what's the ceiling on each grant for?
We're trying to do targeted micro grants, basically to get programs off the door, off the ground between the fiscal year, between the other grant cycles, more or less. We're
Okay.
trying to do 5 to 10K slots. If there's something, I don't think we'll ever go past maybe 10% of the total in a single, between 10 to 15%, just because more smaller grants seems to be the better way to use this money.
Okay.
But 5 to 10, we can give more if it's like, you basically, all you have to do to get this money is convince me and Roberto it's a good idea. And then have Ezekiel, who's our rep at state, agree with us that it is a good idea.
Okay. Tara, did you have a question? Or a
Yeah,
comment?
I had a follow-up question on the behavioral health initiatives. You mentioned new resource Bible and process mapping. What do you mean by the process mapping? I didn't know what that meant.
So process mapping is probably not the best word for it. I did a lot of, I used to be a copywriter for a business analyst, so I have defaulted to a lot of those terms. But essentially what we're going to try and do is map how the organization, what services from each organization refer out to other organizations, so that we can build essentially a map of, if a person enters into the system for a given problem, where do they end up? What areas do they touch? What organizations
Got it.
can benefit from coordination? And then, as it looks that the behavioral health initiative is going to spin off is going to end up being an organization that persists to coordinate across all the behavioral health initiatives. So this is stuff that we're using internally to figure out where resources need to go, in addition to really kind of bulking up so there's a gap. It's difficult for people to find resources here on the island, even if they exist. So us getting this list of all the resources and how they connect to each other will allow us to have kind of a map of, like, residents will be able to determine what resources apply to them if they're in a similar, with an eye to making a similar self-referral tool that they're using in the food security program right now. If you guys aren't
Okay.
aware of that, there's an ongoing kind of self-selecting, self-reporting, self-referring system that they're building out.
I'm just reminding people to mute their computers or their phones.
What was it me? Sorry.
I'm just reminding.
Just a follow-up on that.
Tara?
Do you have a plan to, like, quantitatively measure, sort of, once you've actually created the flow chart and the sort of the coordination benefit, will you actually try to look kind of quantitatively at how it got utilized and was it successful? And
I think,
or
yeah, I mean, absolutely. I think one of the roles of, if this does turn into an independent organization to do this in an ongoing manner, the qualitative assessment that the qualitative and sort of abstracted one will absolutely get a very, very fine tooth comb run through it in terms of who's using what and in numbers. A lot of the difficulties in how that information was collected is that there wasn't a central organization collecting it. There wasn't anyone who could look at everyone's books, and there was no reason for a lot of people to share their books with other organizations because a combination of a little bit of tribal defensiveness and then just it being not relevant. There was nothing that information could do if it was shared. So yeah, there will definitely be much more granular and quantitative analysis of what's going on, numbers served, cost per patient, that sort of stuff. My focus right now, so it's split into 3 or 4 different groups. There's a workforce group to kind of do pooled hiring and resume sharing. And then there's a data portion where they're building a data backend for it. And then I'm currently just working on what we're calling continuum of care, which is the whole system picture, the resources to residents, and then the aforementioned sort of process and structure map and model.
Jericho, may I add something to your list for nonprofits in the health and human services? One of the other challenges as well, when you talk about, you know, the relevancy of sharing that information across organizations, part of it is sheer volume that they're dealing with on every single day, trying to get to their own work. I would say that health and human organizations are notorious for being under-resourced. So they're just trying to keep, you know what I'm saying? So,
Oh yeah.
so
Yeah.
making those connections outside of their own agencies, that's not an easy feat.
Yeah. And as a corollary to that, part of the stuff that's coming out of this is we have we're trying to build out a behavioral health service, behavioral health providers, social and like communication events on an ongoing basis. We have a youth behavioral service provider event planned on a quarterly basis at our house. And then there's a variety of, I mean, for lack of a better word, morale and community building, where we're doing newcomers events for anyone who's in spaces adjacent to this. We're trying to make collaboration a necessary element of doing what we're doing here, but we're also really focused on it delivering value back to the people who are participating and collaborating with us. There was that government process solutions survey that was done here last year, or sorry, 2 or 3 years ago. That was the GAPS study is what we were calling it. And we identified like 17 large gaps and then some qualitative measures of them. We've actually managed to improve our coverage in those gaps purely through this collaborative effort on like 5 or 6 relatively big number ones. There's talk of collaborating on housing support for staffing these things. I'm trying to think of the agencies represented include the town. Connecticut Cottage Hospital has a variety of people involved in it. Fairwinds operates in this on several different layers. Gosnolds, the Interfaith Council. We cast a wide net. We got one leadership group. Sorry, we have one steering group, one leadership group, and then 3 work groups right now. And all of those things are moving towards, we're hiring a person whose job it will be to coordinate behavioral health organizations on the island, and that will own that information collection task and own the a variety of the different ability to have both a carrot and a stick in terms of funding and staffing.
And is there a target date for that hire at all, or some kind of understanding of?
I believe the first hire is planned. So right now, the discussion is on the exact structure that we'll have and the exact bylaws. Once that's wrapped up and there's a way to secure insurance for the person, I believe there's an individual who has been contacted as a potential hire in this area. So I do believe that is months rather than on the 2 to 4 months, according to our timeline. I don't have it to hand, so I can't tell you exactly.
Well, that's exciting.
It's immensely exciting. It's actually eaten up, it's eaten up a fair amount of my time, but it's been, I think, one of the most productive things I've done since I started this job. Like we've already, before we even really launched, closed 2 gaps completely. Like 2 of the gaps that we were identifying as like real serious problems. We were helped out by the changes on the state level and the CBHC contract being awarded a community-based healthcare or health clinic, but it's a behavioral health clinic. Fairwind's now getting the crisis contract as well as the CBHC contract, means that they have more resources and are able to do more things, and that we've managed to centralize a whole bunch of stuff under one roof already, while not really losing out on a lot of the collaborative or outside input.
Very good.
I'm trying to think. That's
Anything
basically,
else?
oh yeah, that's basically it for me. Sorry. Any other questions? Ooh, Veronica.
Yes, Veronica. Unmute yourself,
still muted.
please.
Did she just say?
I'm stuck on vaccinations. Just that I know that obviously people are still getting COVID, and we know the benefit of being up to date vaccinated. And also having a little bit of personal experience with the injectors that are coming over. They're sending folks, they're ready to put vaccines in arms, but we need to get more people there. We need to get more people to get the vaccines. And I don't have a solution, but I know that it's a major public health problem still. So,
Veronica, can I ask you a question about that? And maybe it'll be a Jericho question, I'm not sure, but I'm going to ask you since you're helping pick up the vaccines. Are they available at the pharmacies for somebody just to walk in and get one should they want it? And they have obviously the right proof that they've had the needed vaccines up to date for whatever vaccine they're getting?
I'm going to turn that to Jericho.
The answer is no.
I think that would change people's ability to get the vaccine.
Agreed. Unfortunately, up until now, every dose of COVID vaccine that has gone out has been purchased by the federal government and given out for free, and that is ending. And it looks like both of the primary COVID vaccines are getting a 300 to 500% price increase. So and they have yet to alter the packaging. So the primary problem with having a pharmacy manage this, at least locally, is that the handling requirements around it are still extremely tight. You can't waste doses. It's not broken down in small enough vials like a lot of the other ones are, and it's not yet incorporated into regular practice. I absolutely agree. Elsewhere, you can generally find a CVS pharmacy within 10 to 15 minutes of you, that you can find an appointment within a few hours of you. Here, until it's included in the primary care clinics and until the pricing and insurance coverage has been ironed out on it, I don't even think that Dan is going to get back into doing Moderna.
I wonder if they would let you guys come in and be in the pharmacy and doing them.
The only problem with that is I do not have the staff to do that anymore.
Gotcha.
Heather has been unfortunately tied up in a variety of different things. I don't have qualified injectors to do this. And even if I did, I do not have the bandwidth, and I cannot stop the other things that I have going on now to do this, unfortunately.
Gotcha. See, those things are important for us to understand and everybody else to understand as well. Thank you for that. Just very quickly, since we have some airtime, just in case anybody is going to see this or watching, where can they still get their vaccines?
So we have 2 more scheduled state clinics that you can sign up for at nantucket-ma.gov/vaccine. The February clinic is scheduled for February 7th. The March clinic is TBD, but should be between 21 and 28 days after the
You
7th.
cut out just there for a second.
Ironically, at the most important part. The dates for the February clinic are February 7th. The March clinic will be between 21 and 28 days later. The state program, which that these vaccinators come with, ends in March. It's uncertain if it will be extended, but it seems to be unlikely. And the on-island vaccination picture post that is uncertain. My suspicion is that it will turn into something like flu, where the state, not the government offered vaccines will be done once or twice a year in the fall in large batch mass vaccination efforts. And it'll be a seasonal variant specific version of the COVID vaccine. However, that's all stuff that will be decided at a federal level initially, I think. There are too many moving pieces, and I do not know enough about what's going on to have any real picture of what that's going to look like, anything more than a 2 to 3 month line out.
Okay, thank you.
No
So I
worries.
think we should move on so we don't get, unless anybody has a burning question about that.
And
Okay,
of course, if you guys have any questions outside of this time, if something occurs to you that you want to try and get an answer for, you can email me at any point, and I will do my best to find the answer for that.
thank you. Because we've been on for 40 minutes, what I'm going to do is on the next agenda item, ideas for human service guests. I just want to say that Veronica and Jericho and I had an opportunity to talk, and we were talking about having the DEI.
Kemal McCarthy.
No.
Town appointed or hired person in for I think our first person, right? Were we thinking that? Yeah, because we've been talking about that for a little while.
Yeah, and ironically, I just had a chat with Kemal today on a different matter, and he was like, "We should do something official, like work related, to collaborate on." And I was like, "I have an idea for you." So the bug is in his ear. If we got to go ahead, if you guys want him to be the first person, I will send him an email tomorrow morning, and we should be able to get him scheduled for the next one.
Is that something we need to vote on, or can we just do that?
I think you can just give a visual, like, so generally, as long as it's if it's unanimous, we don't need to identify the people. I just need to say, for the record,
Okay,
it was
thumbs up,
unanimous
thumbs
positive
up.
vote.
I think we
Yeah.
have unanimous.
For the record, that is unanimous to have Kemal McCarthy give a brief presentation on the DEI project that the town has undergoing, or the DEI department that the town is building, I should say.
Mhm.
Thank you. And for any other ideas about who we would like to have as guest speakers, if you can send an individual email to Jericho with your ideas, that would be fantastic. Just so we're time sensitive, instead of talking through it here, we can talk about those at a later meeting.
And then the other plan was to go through, at least initially, the grant recipients from the CRC grants, and just sort of file them through. I know that was a plan Brooke and I actually talked about back when she was still chair, that we just never got quite around to. So I think that once we get Kemal on, and once I got a list of if there's any other organizations you guys think, I'll just the meeting ahead, like we'll talk about Kemal, and then after Kemal does his presentation, I can be like, here are some options, yay, nay, which one do we want to go first, and then move on like that on a month-to-month basis.
Sounds good. And we can also invite them to talk about what CRC monies they get and what they do with them, because that changes each year. It stays the same for some people, but it changes each year for others. So I think that would be a great thing for us to yearly get an update on, to see what's being done with that money, how it's affecting the agencies, and have the community be able to hear that. Okay. We will move on to the next agenda item, which is Suzanne, how my idea for the media came up was a year ago. We talked about future project brainstorming. So I would like to give that a little bit more time today. Let's say 5 minutes of talking about some ideas. And then if you have any follow-up ideas after we're done with the meeting, if you want to email Jericho with those, I think that would be great.
Okay, so what do you guys want to see, or what do you want to have us work on?
Well, I guess, we've already discussed some of this with, the way I look at it is we are a mouthpiece for services, and to be able to let people know and maybe drive them to our meeting site or whatever we're doing, to let people know what's available out there. Because as one of the things, of benefit of being on the contract review committee, for me, being relatively new as a full-time resident on the island, I'm learning an awful lot, and I'm learning how much there is out there. And I don't know how many people really know what's out there. And part of what you were talking about, Jericho, with the behavioral health initiative, connecting those dots, that's just in one area, but there's so much more. And if we can somehow be part of that advertising for what's there, because before we really can see what gaps we have, we need to talk about what is available out there and let people know what there's there. And then we can see where the gaps are. So.
Very good. And Veronica, just because I don't want to forget, and then we'll go to Suzanne. You also brought up an issue a couple months ago that you had noticed over the summer. So do you want to bring that back to the table and get that on this year's?
Right. And that actually is how we started talking about Kamal McCarthy, of just, just to refresh what I had brought up at that point, just some observation during our peak summertime, and just being a fly on the wall, and just watching how our, some of them are maybe employees, some of them are private employers, but beyond the fact that we are driven by tourism, we're a community, and just having people all treated with respect. And so we started talking about that. And then the idea was to invite Dr. McCarthy as part of the diversity, equity, and inclusion. Is there some kind of a training that we potentially could put together, how to deal with people that may be coming from different cultures, different, maybe making us all a little bit more culturally diverse. So that's, in a nutshell, where that came from.
Great, thank you. Will you also email that in just so we have it to Jericho? Okay.
Yeah.
That would be great.
My email is my memory prosthesis right now, so get it in my inbox and then I might be able to remember it.
Thank you, Jericho. Suzanne?
Excuse me. I had the idea that, so I work part-time at the library, which is a remarkable community resource. I see a lot of people coming in and out. I started in July. There's a lot of visitors. Then and now I'm seeing a lot of the year-round people, the islanders, and a lot of them I know from my various incarnations locally, with kids in the school system, working for a construction company, working for a doctor's office, working in many different, wearing different hats. And so I know a lot of these people. And one of the things that's available that people don't even realize, I don't think, is the use of the library for public events happening, speakers, and and Kamal is one of the people that pops in often, and so I kind of know him. But one of the things I was thinking is maybe we could get a hold of somebody on the staff to set up a talk that would share what services, what the Council for Human Services can do for the island, because there seems to be a little bit of a disconnect between, in my view, having been born and raised here and left the island and come home to live, there seems to be there's such an emphasis on this island on money and making money and what Nantucket can do and the real estate business. But then there's the other part of things, living here daily, and how do people cope and how do people do it. And so I don't know how we'll get those two things, that what we're concerned with as important as making money. I don't think that's probably going to happen. But what I think needs to be more in the public's eye is what is available, and to maybe use the library as a resource too.
Right.
And I hope that's not some kind of conflict of interest. I'm just a part-time worker there.
No,
And I'm
no, no.
just a suggestion because it's available to the community.
No, the Athenaeum is like a cornerstone of so many different things on this island,
Yeah.
that it's a human service.
Yeah.
I would almost like, if you could, to get the Athenaeum involved in this on an ongoing basis would be fantastic. And I have a couple of projects I've been meaning to broach with them as well. So I might be emailing you, actually.
Okay. Because I'm just thinking of the ladies downstairs. I work on the front desk in the main circulation department, but I do know the people that work in the different departments, and it wouldn't be under adult education. But one thing that Veronica was talking about is getting different groups of peoples. And we have a lot of, different cultures on this island. And probably, I don't know if any of you are aware of it, but we have on Mondays and Wednesdays, language labs. And so people can come in and sit and have an hour of conversation and music, and Sammy sets it up as, like cafes, and there's Portuguese, there's Spanish, French, there's sign language. Italian, yes. And that's where I saw you before, coming into the library. So it's, there's a lot going on that people can join into.
Great. Thank you, Suzanne. That's really helpful.
Okay.
The other thing, and I just keep getting ideas from things you guys, brilliant things you guys say. So these aren't even my ideas. Jericho, you said new services or new projects as you were talking to Suzanne. That would be something I feel like we could do instead of us reaching out. Well, not instead of, but additionally, having the places on island know that they can contact us and request to be on to talk about the new projects or new services that they have, because we may miss that. We may not know that there's that particular one and we've got this lovely lineup of people coming in, but here's this great project going on that's just not getting as much airtime. So I think if we could put ourselves out there to the human services on island and say, if you have something new that the community needs to know about, you can come here and talk about it and get it out into the community through the CHS. Jennifer?
I would also say not just new, right? But there's probably just a lot that already exists, to Suzanne's point about the library, of how do we just get the word out about the great resources that already are here,
Right.
that people might not know about, right? You have to tell people, because in this moment, I might not be interested in addiction and recovery or whatever, but 2 years from now, it might be really present in my life. And so I need to be told about it again.
Right. I think that's great. Thank you. Tara?
Yeah, just to that point, one of the things that we do in Connecticut, here is that we actually have an organization come to our meetings each month and give a 5-10 minute just overview of what they do, what they're doing, and contact info. And I'll ask have the council have the opportunity to ask some questions. And it really just, it engages both sides, but also provides, a little bit more info. So.
Right. Great. Any other burning ideas right now? Okay, so if anything else, keep the wheels turning, and if anything else comes up, please email Jericho. And I appreciate all the good ideas you guys brought up today. Moving on to the next is human service bulletins.
And I think this is the spot we were going to have Amanda explain the change in crisis at Fairwinds. That's because it was going to be the relevant, the most, if you're going to remember one thing from the meeting, it would need to be that. Since Amanda cannot be with us today, it probably would be best for us to table that until.
Okay, we will table that. Thank you. I was wondering where that was. Okay, so we are all up. Veronica.
Oh, you're muted, Veronica.
And it somewhat is part of what we were talking with brainstorming, so I'm sorry, not bringing it up then. Worcester Polytech Institute, WPI, every year has approximately 15 to 20 students that are here for one of their quarters. So it's typically the middle of October through Christmas time. And any organization, whether it's the town or private organizations, can present a project for them to work on. And they're typically in their junior year. My son did this back in 2013, I think it was 12 or 13, he was here. And every year they do a presentation of the projects they've worked on. So right before, like the middle of December, it's at town hall. And this year, listening to the projects they worked on, they're just incredibly bright students. They come from all different disciplines, and they work on not something in their area. They're a chemical engineer. They're not just working on that. And so they're learning interdisciplinary skills and using scientific method. And I just wonder if it may be a little bit too late for the projects that they'll do this fall, but if there's something that we either identify that can be turned over and have a group of students work on a problem or an issue, a delivery system, etc. This year they did everything from the sustainable market, sustainable farms had a group work on a portable or chicken processing system or whatever. So being able to raise and slaughter chickens on the island. So it goes from there. And then another group worked on with community folks, community school on adult education and what more is needed in adult education. So you can see like the diversity, and they also have worked on, harbor cleanliness, pollution, et cetera. So it's very broad, but it would have to be managed. They need contacts to work with, but they come with one or two professors who oversee them. They're housed on the island. They're given bicycles by Youngs to get around. And you'll see them in October when they show up. They're all wearing their WPI, spirit wear. And, they're out there and they're enthusiastic. And I think it's good for both sides, the students and also for the island. So if there's something that we can come across, but we don't have the resources, it's a potential. So to keep in mind.
I have two things that I know really bother our population, or at least a lot of people in our population. One is during hunting season, the entrails getting thrown in the woods all over the walking trails. I've just kind of regurgitating what I've heard our community just kind of hit their head against a brick wall about. 2 is dog poop bags getting tied to fences and left. So those are both 2 community thorns in our sides. Has everybody heard about these?
No.
Yeah. Okay, so just to stick that in our back pocket to remember, and I don't know if those are the kinds of things they work on, but
Well, it could be developed probably into a larger thing, because one of the projects they worked on a few years ago was, now that we have our multiple streams at the dump, where you have your non-compostable, non-recyclable, and then you have your compostable and whatever. It was one of their projects. They had a group of students out there digging through trash and figuring out how could we reduce the amount of trash that has to be taken off the island. So that's the kind of things that, some of it, there's outgrowth, others it could just give people reason to ponder. But you know, the projects are quite diverse, but it takes presenting the projects to them, and you need an organization that they can work with. So
great. That's a great idea. And now that you say WPI, now I can remember seeing them wearing their stuff around, and I was like, I wonder what that is, but then I moved on. Thank you. Thank you. All right, a moment for any last comment or question, and then we can look towards adjournment if nobody has anything.
one last thing, our next meeting is,
I was just looking at the dates, actually. February 16th looks like a potential date for us. It's before the school break, and it's a Thursday. And I just wanted to talk about timing. Was 4 o'clock okay?
Let's, so 4 o'clock works for here. There was one day that wouldn't work for Sue. And I want to touch base so we can make sure we can slice some time out for her.
Okay, let's just see if for everybody on this meeting, if it works, and then you can check in with her. Thumbs up. Great, so for everybody here at work, so Jericho, can you check with Sue? Sorry. And then get back to us via email?
Yes, that will be acceptable. And may I ask, can we push ahead or back 30 minutes or so if that changes things? Just if I'm trying to figure out a time for Sue.
Can
Okay.
people put thumbs up if ahead or back 30 minutes is okay?
Okay.
Yep. Okay, does anybody want to make a motion to adjourn?
I'll make,
Sarah, and second?
I'll make a motion to, yeah.
All right, that's it for the meeting. Thanks,
Sorry,
everybody, for showing up.
I have to do that by roll call, unfortunately.
Let's do it by roll call.
That one has to go by roll call.
Guys, this is what happens when I've been off for a month. I miss, and I'm just not up to speed. Okay, Veronica,
I,
Tara,
Aye.
Jennifer, Suzanne,
Aye.
and I. All right, now we're good.
All right, sorry
Thanks,
about that.
everybody.
That's okay. Thank you, Jericho. I appreciate it.
have a good
No
night.
problem.
Bye,
Great
everyone.
meeting.
See you later, everybody.
Bye.